You're listening to This Week in America with Rick Bratton.
Welcome back, everybody. This Week in America. Thank you for joining us on the program. Website, of course, thisweekinamerica.us. With us on the program today, Dr. Rudolph Cumberbatch. He was born in Barbados, moved to the United States for college, studying at Columbia, got his medical degree at Harvard Medical School, served in the U.S. Air Force for 18 years, was in private practice. From 1985 to 2005, worked in the Veterans Healthcare System as Chief of Surgery. He retired in 2005. Still has inside sources at the VA hospital, and that's the basis for his book, Failure Masquerading as Success, the Veterans Healthcare System, a Microcosm of the Current Federal Government. And with us on the program today to talk about the book and the VA healthcare system is Dr. Rudolph Cumberbatch. Doctor, welcome to the program. It's great to have you with us on the show.
Thank you for having me.
This is a really important book and a really important message. And we'll spend a little time here at the beginning just talking about your background and your interest in, I mentioned Barbados, your interest in medicine. It started at an early age. You sustained polio, I understand, at age 2. And because of that, you had familiarity with the medical profession. And you had some relatives that were involved in this. So studying medicine and helping people, this has been something basically you've been interested in since a child, wasn't it?
Yeah, correct. Yes, my favorite cousin was a student nurse. And when she came home on weekends, she discussed all the interesting cases that she treated. One including a British seaman who was burnt on a merchant ship when a German submarine fired a torpedo into the harbor. And this was very interesting. And also my stepmother introduced me to some physicians and told me what physicians did. Of course, having some residual from my polio also spurred me to choose medicine as a career.
You decide to come to the United States, studying, like I said, at Columbia, your medical degree at Harvard, and you describe the early years here in the United States as a culture shock. Explain that, coming from Barbados over to the United States, and besides studying in the New York area, you traveled extensively around the United States as well. What was the culture shock aspect when you came here?
Well, I'll give you an example that was kind of an interesting example. Yeah, as I was getting my shoes shined, patrolman, a policeman came by and wanted to look at the book that I was reading. It was a book on chemistry, and I was curious why he would want to look at this book, and I asked him if he was interested in science and so on. In actual fact, he thought I might be selling drugs, and so he would check the book to see if there was any drugs in the book. At that time, I had no idea what he was looking for, and so I was taken by surprise about the whole procedure.
Yeah, and I guess that would fall into the category of culture shock. With us on This Week in America, Dr. Rudolph Cumberbatch. He's the author of the book, Failure Masquerading as Success, the Veterans Healthcare System, a Microcosm of the Current Federal Government. He's very familiar with the healthcare system, working in it for 20 years as Chief of Surgery. Let's talk about, you're here during the Vietnam era. You serve in the U.S. Air Force, and you end up at Wright-Patterson Air Force Base outside Dayton, Ohio. Talk about that experience there.
Dayton, Ohio, the Wright-Patterson was one of the referral centers for people injured and treated in Vietnam, were transferred for definitive care at the Wright-Patterson VA. And so I became very familiar with injuries and on war and what was going on and the devastation on the human body that was occurring in Vietnam. And this, again, spurred me to be interested in treating veterans at a later time.
When you started work with the Veterans Administration, I mentioned in 1985, when you went to work there. Talk about the system at that time. From what I understand, the VA hospital system went through years where it seemed to be running quite effectively, and it did during most of the time that you were with them, or at least for the first few years. Talk about what the system was like back in 1985.
The system was very functional. There was a VA headquarters and there was the individual VAs, and there's a very close correlation with the staff. In other words, the surgeons were able to communicate with a chief surgeon in the central office, and there's a lot of back and forth discussion about care and ideas. There also was a very strong Inspector General and Medical Inspector's office that made frequently visits unannounced and sometimes unannounced to check on the individual VAs to see how they were performing. And this really gave a sense of continuity and single purpose by having this kind of connection. We had, of course, a triad which consisted of the director, the associate director, and the chief of staff. And the chief of staff was primarily responsible for the kind of care delivered and also for the performance of all the clinicians on staff. So this resulted in very high quality care with corrections when there were problems. And this was a very successful system at that time.
Dr. Rudolph Cumberbatch is our guest on the program, author of the book Failure Masquerading as Success, the Veterans Healthcare System, a Microcosm of the Current Federal Government, a system he knows very well from his 20 years as working as chief of surgery. When you talk about the triad format and reading about it in the book, and the book does an excellent job of laying the groundwork, how the whole VA system came about and what the functions and how the functions changed over the years. In talking about triad, that almost sounds like a teamwork where everybody really worked together. Is that a good description of
that was the concept, and it worked very well. The director listened very carefully to his assistants and the chief of staff, and there was no John Wayne attitude where the director went off and did things on his own without consulting with the appropriate people. Yet there was also a lot of communication with the central office, so that it was a tight ship, and things worked very well.
Things changed and you mentioned the 90s during the Clinton administration, bringing in a Dr. Kaiser who brought in an HMO concept. This was, I mentioned, you were there in 1985 when you started with the healthcare system, the Veterans Healthcare System. Why that change? And then talk about how that really started things at a downhill slope at that particular point in time. It seems like things were going well. Obviously, somebody thought the HMO system was going to work better. Talk about that change and the impact it had.
Well, the concept was that the HMO system was going to be more cost effective. It would prevent patients from going directly to their specialty, like the orthopedic surgeon, which means that there would be more time for people with real problems. And so the concept was that you would have to go to your primary care physician, who was a gatekeeper, and he would then decide whether you should be referred to a specialist or not. This concept worked very well in private practice because you had a range of young people and old people. In the VA, where most of the veterans were 60 plus or older and had degenerative disease, hips, their knees, and also had chronic heart conditions and pulmonary condition, this did not work because it took forever to get to your primary care physician. And then, in addition, it took time to get to the specialist. So patients with cancer of the colon, for example, or cancer of the lungs were often delayed a couple of years because it would take them about 6 months to get into their primary care, and then probably another 3 months to be referred to the specialist.
This
was a very destructive system, and was not the system that the VA needed to perform its mission.
How frustrating was it for you, chief of surgery at the time? You're transitioning from what worked out to be with the triad system, something that was very effective, to something new, good intentions in the beginning, but in a practical sense, it was not working. How frustrating was that for you?
It was very frustrating because remember previously you could talk to your counterpart in the central office and get some action done. More and more, each VA worked on its own with the director running the show. And so it was pretty much impossible to get any improvement. It was very hard to hire gastroenterologists and thoracic surgeons. And of course, the VA did not want to pay for them and did not want to refer patients outside of the system because it costs money. So the whole concept of saving money meant at the cost of decreasing the type and the quality of the care.
Dr. Rudolph Cumberbatch, our guest on the program, he's author of the book Failure, Masquerading as Success, the Veterans Healthcare System, a Microcosm of the Current Federal Government. The book's available at Amazon. You can link directly to Amazon by going to our website, thisweekinamerica.us. Rapidly running out of time, and it's a fascinating topic and an interesting topic, and one that's certainly in the news and people are concerned about all across the country. You mentioned several things that occurred. One is growing new directors from within. Talk about that process and how detrimental that has been to healthcare.
Well, again, it was a decision made to reward people as they came up through the ranks. So instead of looking outside the system for directors, they thought it would be cheaper and better and good for morale to advance people from inside the system. So there was a special training program for people chosen by the director. They were advanced up the line and eventually ended up being associate director or director.
And presented, obviously, a new set of problems, and you see bonuses that were being paid. And as we heard around the country in various cities where they were having particular problems, people from there were eligible for bonuses, which as you're reading the news account of that, it's like, this doesn't make any sense at all. This is one of the cities that has a backlog, yet somebody is getting a bonus. PR people, you say, and it was what in 2000, directors started bringing in their own PR team. So I guess if we can change the image, we really can't change how the system is operating, but we can try to change the portrayal of that in the media. How detrimental was that?
Well, of course, as I said previously, the chief of staff was responsible for the quality of care. The director took this over, hired his own quality care staff. And these people, of course, cooked the books because the whole idea was to make the director look good so that he could get a bonus and he down the line could give bonuses to all these people. The number of administrators doubled in this time so that there were less and less doctors and more administrators, which of course was bad for the system because we're delivering care, not just administrating a VA. And so this was a real problem and responsible for a lot of the deterioration in the system.
We've heard a lot about the system in the last 6 to 8 months. You have people that are very active in the system, still there. We've talked a lot about changes. We've heard a lot about changes. I'm not sure what changes actually have been implemented. But in talking to the people that are still with the VA healthcare system, are they seeing any improvement?
No, there's no improvement. The problem was that before there was very close coordination with people who knew their job, clinicians and so forth. This has all changed, and there is very little coordination with the clinicians. What happens is that the director from the central office or the secretary or the assistant comes down and talks to the director at the local level. But the two of them have no idea what it takes to provide quality care. And so this is a complete waste of time. The need to reinstate the communication between the central office and the local VA among the clinicians, and also bring in the inspector general to do inspections from time to time to keep everybody honest. We certainly do not need a large PA body like has been established, because all this does is cover up what's really happened so that the truth never comes out.
Talk about the inadequate number of doctors. Are there enough in the system now?
No, they're not. And especially specialists like gastroenterologists, cardiologists, and orthopedic surgeons. There are very few in the system. And when they're referred to the university, they also have a backlog. And so we need to hire physicians across the board and pay them adequate salary in conjunction with what the market is paying at this time. And of course, cut out the bonuses and rein in the directors so that they're not running loose like this, that they're privy to do whatever they think should be done.
Do you think?
Yeah.
Do you think it's necessary to refer some to private hospitals, doctors, clinics to try to? I mean, you hear some of the backlog, and it's months, if not years. Do we need to go to the private practice for assistance to get through this?
We definitely do, and right, especially now with the backlog, and even when the backlog is reduced, there are not enough specialists in the system to often perform the functions that should be performed. Certainly cut down the delays in referrals. So some referrals to private practice is necessary.
As we're taking a look at the system and trying to figure out, okay, how can we make it right? Because it hasn't been. Is there enough input from physicians? Because from what I hear and see and what I'm getting into reading your book, Failure Masquerading as Success, you've got a lot of administrators that are making decisions, and I'm thinking, where are the medical people? Are they even listening to the medical people?
No, they have not. And previously, if you had a problem as a clinician, you could talk to your counterpart in the central office, as the chief of staff or the chief of surgery or medicine. This avenue no longer exists. And so if the director doesn't listen to you, there's nothing you can do. You just continue doing the best you can. But a lot of the problems that exist is because the director is doing things that he has no qualifications to do, and refuse to consult with the specialists that are on the staff.
We got about a minute left in the program. You mentioned before the role of Inspector General, and that's someone we think of as the public. We think this is someone who comes in, they really are totally unbiased as they come in. What's the role of Inspector General in getting back to really coming in, monitoring the situation, and when they see problems, being able to point these out and hopefully get some resolution?
This used to be, the Inspector General used to be a very unbiased and non-political system.
Right.
Now it is not. When the Inspector General comes down, for example, and has a report, the director of the hospital has to see it and make some input where, of course, this was not the case before. So the report is generally doctored to make things better for the director.
The book is an important one, Failure Masquerading as Success, the Veterans Healthcare System, a Microcosm of the Current Federal Government. The author is someone who served for 20 years in the system as Chief of Surgery, Dr. Rudolph Cumberbatch. The book is available at Amazon. Information available. You can link on directly at our website, thisweekinamerica.us. Dr. Cumberbatch, thank you very much for being with us on the program. A very important topic, as I mentioned, and one where it's rare we get an inside view. We have your 20 years as Chief of Surgery. We have the input that you still have with contacts back working within the system. Thank you so much for joining us on the program. An excellent book, and we thank you for being with us.
Thank you very much, Rick.
It's been my pleasure. Once again, the book is called Failure Masquerading as Success, the Veterans Healthcare System, a Microcosm of the Current Federal Government. Information available at our website, thisweekinamerica.us.